Thank you again for joining us this morning. We are very excited to share with you about this provincial assisted transportation project funding and the expression of interest. Before we get started this morning, we would like to start out by doing a land acknowledgement. In the spirit of our journey to promote reconciliation, we would like to honor the truth of our shared history and acknowledge the many First Nations, Métis, and Inuit peoples who have lived and cared for these lands that we live, work, and play on for generations. We are very grateful to the traditional knowledge keepers and elders who are still with us today and those who have gone before us. Healthy Aging Alberta, we are a provincial initiative, and our regional community developers who are here with us today live on the traditional lands of the people of Treaties 6, 7, and 8. And I just like to kind of always end by reminding us that we are all treaty people. Next, I'm going to hand it over to my colleague, Lauren, to just give us a bit of a sense of what to expect today.
Thanks, Jasmine. Just to ensure that everyone's comfortable as we move throughout our Q&A session today, if there's something you require for your comfort, just reach out to our HAA team through the chat box. Your chat will only be visible to the host. And please use the Q&A box to submit any questions you have, and we'll answer each of them as they come in. But if you're unable or uncomfortable using the Q&A box, please raise your hand and we'll call on you to verbally ask your question. When using the Q&A box, please ensure the send anonymously box is not clicked in order for everyone to see your question. And then following today's session, we will upload the recording to our Core Alberta website and add questions to the facts section on the Healthy Aging Alberta webpage. Feel free to access either source at any time. And into the next slide. I will just give you a little overview here of what we'll expect today. Shortly, we're going to move into a quick overview of the Healthy Aging Alberta initiative, and then we'll get into the heart of the discussion today, focusing on that expression of interest for the second phase of Provincial Assisted Transportation project funding. So now I'm going to pass it over to Amanda to introduce the Regional Community Development Team at Healthy Aging Alberta, and she'll give us that brief overview of the Healthy Aging Alberta initiative.
Anine Boujou, thank you everyone for joining us today. So I would just like to take a minute to introduce our community development team. So on your screen is each of our regional community developers, RCDs. And to begin with, we have our team lead, Rebecca Aspden. She lives in Alex, and she covers the Central Alberta region. Next, we have Lauren Slavic from Crow's Nest Pass, and she is our Southern Alberta RCD. Then there is myself. I'm Amanda Harriman-Goyton, and I live in Edmonton, and I cover Edmonton and surrounding area, and some of the portions of Northwest Alberta. Next on the screen, we have Marla Cayley. She lives in Calgary and covers Calgary and the surrounding area. And last but certainly not least, we have Michael Przinski. He's recently joined our team. He lives in Bonnyville and he covers most of Northern Alberta. Next slide, please. So this is our constellation of networks, and this model reflects our work around creating strong collaborative networks at the local, regional, and provincial levels. And the most important aspect of our work is connecting with community and really understanding the work that you do and the successes and the challenges that you face. You are the experts in your communities. And as a matter of fact, the funding that we are speaking about today is really a direct result of the conversations with organizations like yours. And this illustrates the impact of the trust that you have in relaying your issues to us that you see when you're serving older adults in your communities. And your RCD is here to support you through the expression of interest process. And each and every one of us would be happy to have a conversation with you and to be able to answer any questions that you may have. And now I'm going to turn it over to my colleague, Michael.
Perfect. Thank you so much, Amanda. So this slide here, this really helps to outline the social determinants of health. These are the non-medical factors that influence health outcomes. They are conditions in which people are born, grow, work, live, and age, and as well as a wider set of forces that shape the conditions of daily life. This is relevant to our work as research shows that the social determinants can be more important than healthcare or lifestyle choices, which influence health and well-being. Over 80% of a person's health depends on the social determinants of health. This includes food, access to social activities, and relationships with others. And all of these can be impacted by a lack of appropriate access to transportation, which should be a baseline for older adults to age well. We currently have funded partners in communities throughout the province that are positively impacting other baseline services, including non-medical home supports and social prescribing. If you'd like to hear more about these programmatic initiatives, please reach out to your regional community developers. Can you folks imagine the impact on wellness in general and healthy aging in particular if organizations had the capacity to address and connect to all these areas at the community level? Just move to the next slide. Thank you. This slide here helps to demonstrate the relationship of the many organizations and how they enhance older adults' ability to experience healthy aging in Alberta. Many of you are here today as part of the community-based senior serving sector, consisting of diverse organizations providing services and programs for older adults at the local level. We also have colleagues joining us in allied sectors who are integral to our approach to integrating healthcare and all community-based supports, essential to enabling Albertans to age in their homes and their communities, as well as lower the risk of seeking hospitalization or long-term care. Moving towards a co-creation approach to prevention and considering the whole person increases holistic and person-centered care. The purpose of this co-creation approach was to enhance the support and care provided to older adults in Alberta, to enable older adults to age comfortably in their own homes and communities, empower older adults to remain in their homes safely as they age, and engage communities to discover challenges, opportunities, and insights. And finally, to embrace systems levels collaboration with related sectors, including health and housing. Thank you, and back to you, Jasmine.
Thanks so much, Michael. So in today's session, we are going to give you an overview of the Provincial Assisted Transportation Project funding. Oh, and I realized I should have introduced myself from the very beginning, but that's okay, I can do it now. So my name is Jasmine, and I am the Provincial Aging and Community Supports Project Manager with Healthy Aging Alberta. So like I said, we're going to do now is give you an overview of the Provincial Assisted Transportation Project funding. I'm going to begin by giving you a high-level overview of the grant opportunity and speak about the eligibility criteria. Then I'll review the questions that are contained within the expression of interest. And again, please feel free to use the Q&A box to ask questions. And what I'll do is I'll sort of pause at each slide to take an opportunity to answer any questions that folks might have. And if you do have any other questions following today's session, you are welcome to reach out to your regional community developer or myself, and we'll make sure that we share our contact info at the end of these slides. So I'll start by talking about some of the details around this grant opportunity. So this Provincial Assisted Transportation Project funding is to support rural communities in the delivery of assisted transportation services for older adults and persons with disabilities. This funding is for, could be for new programs, or it could also be for expansion of existing programs. As the social determinant of health, transportation affects almost every other determinant because it impacts our ability to be able to access needed services, including medical, social, and basic needs. And this project looks to see local community organizations and partnerships deliver innovative assisted transportation services to older adults in their rural communities to promote access to medical, social, and basic services essential to folks' well-being. Expressions of interest opened this past Monday, and the submission deadline is Friday, February 9th. Project implementation will start August 1st of this year and will go until March 31st, 2026. And the maximum amount of funding that organizations can apply for is $175,000. This opportunity is open to qualified community-based senior serving organizations with the capacity to introduce new or expand on the delivery of transportation services for older adults living in rural Alberta. Organizations need to either have charitable status, be a registered nonprofit, and if you're an organization that does not have charitable status, so you're not considered what the CRA would refer to as a qualified donee, there will just be some additional processes to be able to go through. So I'm just going to pause right now in case there's any questions before I move on to the next slide. All right, so a couple of questions I can see. So is the funding amount total for the project or per year? So this funding amount is for the entire project. Yes, it does include municipalities, provided your municipality is a qualified donee. And my experience so far has been that most municipalities are qualified donees. There's a very simple way to look this up, and that's to go onto the CRA website. And for eligibility, I am going to go into that just a little bit more in the next slide, but in terms of eligibility, you either need to be at a high level, a registered charity, or a nonprofit, so like a community-based senior serving organization. So now I'm going to speak a little bit about the criteria to be able to apply for this grant. So the first, as I've said a couple of times already, is that this funding is for rural and remote communities. And we use the following definitions. This is also on our website when it comes to talking about rural and remote communities. So a rural community is defined as populations typically of less than 10,000, although it could be more, and up to 200 kilometers from a metro or urban center. And remote is defined as a community being greater than 200 kilometers from a metro or urban center. And if there's anything around this kind of piece that's a bit unclear, we would really encourage you to go to our website, and on the bottom of the website, there are some links that take you directly to the Alberta Health Services page that we are using, and that's where those definitions come from. The other criteria, like you can see on your screen, so one is that there is a high density of seniors, that you will have a high percentage of low-income seniors in your community, that you have established non-transit transportation services. And this is one that can sometimes be a bit confusing for folks. So I like to use the following example. So the funding is open to rural communities without transit. So for example, the communities of Whitecourt, Hinton, and Edson are all rural communities, and in some cases remote communities, with populations of about 10,000 people. But Whitecourt and Hinton have established transit services within their communities, and Edson does not. So Hinton and Whitecourt, for example, would be communities that would not be considered eligible for this funding because they have transit. And Edson, for example, would be considered a community that would be eligible for this funding. And as some of you may already know, Edson did receive funding in phase 1 for this project. So we're looking at communities that have or are looking to establish non-transit transportation services within their communities. We're looking at communities that have a demonstrated gap in service. So we'll talk about this a bit more when we go through the expression of interest questions. But you know, from your perspective of all of you folks that are here with us today, we want you to be able to talk about what are you seeing in your community? What's the gap in service that you're noticing? We're also looking at projects that have an evidence of past success serving older adults. So tell us a bit about the work that you're doing, you know, already serving older adults. Demonstrated capacity to expand, evolve, or establish assisted transportation programming. And then an innovative approach to service delivery that's focused on collaboration and working in partnership with both community organizations and for-profit services. And so an example of this would be, for example, working in partnership with a taxi company. And so in one of the projects, for example, in phase one, they have this really brilliant partnership with the taxi company in their community where they have like a taxi pass program. And so they've worked together to be able to provide some subsidy for folks to be able to get around their community. So that's just one example. So it doesn't just have to be, you know, a nonprofit that's doing the work. You can partner with others within your community. There's a question that's come in. What is non-transit transportation? Transit would be, so I'll give an example. It's usually easier to talk about like what transit is. So rural communities that have a transit program, for example, would not be eligible for this funding. So like I said, the communities, for example, of Whitecourt and Hinton have a transit program that goes around their community. Many of these communities as well also have some other sort of transportation that is accessible to older adults and persons with disabilities. So for example, in Cold Lake, that's another example of a community that wouldn't be eligible because they have transit. So they have within their community already like a transit service, and then they also have a service that is accessible to door-to-door service. So this funding is specifically for communities that do not have a transit program happening in their community. And if that's not clear, I totally understand, and feel free, you can reach out to us afterwards, and I'd be happy to answer any other questions one-on-one. I'm going to pause now though and just ask if there's any other questions or anything that maybe you folks are wondering about before I get into the actual expression of interest questions. Okay. So the expression of interest is not very long. It's only 4 questions. And what I'm going to do is I'm going to review each of the 4 questions and kind of give you a bit of a sense, tips and hints around how you might best answer these kinds of questions. Okay, so a couple questions have come in the meantime, so I'll answer these ones kind of like as we go. So, okay, first, it's non-transit transportation. So if you're a nonprofit, for example, and you're offering transportation services, you would be eligible to apply for this funding. So I'll say that. Also, if you're a municipality and you don't have transit and you're like, hey, we want to start offering some transportation services, maybe you're an FCSS in a community and you're like, we don't have any transportation services for our older adults right now. We really want to start something. Totally, that's fantastic. You would be considered eligible as well. Another question has come in. We have a service that only runs 2 days a week locally, but our seniors need to get to the city for medical appointments. Does that count as transit? I think I would need to talk to you, or our community developers would need to talk to you a bit more around like what that sort of looks like. I'm not sure that would necessarily be considered. I wouldn't, off the top of my head, I would say that probably is not considered transit. Okay, I'm going to go through the expression of interest pieces right now. And then what I'll do is I'm going to come back to all the questions that I can see here. And this is really great. Again, I'm just going to put in a small plug here for our community development team, who part of what their role is as community developers is to work with communities around their expressions of interest and all of those kinds of things. So I'm just going to go through the questions now, and then I'll come back to some of the ones on the screen because I feel like there's going to be a lot, and I think some of them might be duplicates. So we'll go through this. So the first question in the expression of interest is for you to tell us about your rural community and include an overview of the current need for affordable and accessible transportation for older adults. So what we really would like you to do is to describe your rural community for us. Tell us, what are you noticing in terms of gaps in service for older adults? What are the needs in your community for older adults as it relates to transportation? And what is happening for older adults in your community as a result of the lack of transportation? And so, for example, let's say you are a community that is needing, or one of the gaps that you're noticing is folks have medical appointments, for example, in Edmonton, and they're unable to get there. That would be a gap that you're noticing within your community. And that would be, when you're describing and telling us about the need, that would be like a great example of that. Also, think about what your community looks like. So in some of our projects that are happening right now, they're working within, say, like a regional area, and other projects are working very much just sort of within like a town. And so it's very much up to you in terms of what the scope is of your expression of interest and how broad it is. So I'll give two examples. The municipal district of Smoky River was funded in phase 1 of this project. And in their project, they are providing transportation services to folks who live within that entire municipal district, and actually in some of the surrounding municipal districts as well. They provide transportation services around the MD, but they also provide transportation services from the MD to places like Grand Prairie, Peace River, yeah, those are the two I can think of off the top of my head. So it's very much up to you. I think the most important thing to think about is, what are you noticing in your community? Like, is the issue in your community very much regional based? Is it about getting from one, say, village in your community to a town where the services are? Is it getting from, a town to like a major center to access medical appointments? There's no sort of right or wrong answer here. It's really for you to tell us what that kind of looks like in your community. One of the questions that's coming here is talk about the age range for seniors. And that, when we're talking about older adults, that's over 55. And I'm just sort of looking at some of the ones here. One of the questions is around accessible transportation for folks out of town. So they have accessible transportation happening in town right now, but maybe not, to get to a major center. That again, that's a great example of a gap that you're noticing in your community. Absolutely. That would be considered something that would be eligible. Okay, I'm going to move on to the next part. So that's kind of the part around tell us about your rural community. Now, the next part is to describe your project for us. And on your screen, you'll notice that I have 3 little icons here, and those icons sort of represent the 3 core pieces of a transportation program. Or the reasons, I suppose, that somebody accesses transportation. And those are medical, social, and basic needs. And so when you describe your project for us, what we want you to tell us about is, where are you providing transportation service to and from? So, for example, if you are in a larger municipality or a county, which towns or villages are you providing service between or to and from? Or if you're in a town and like some of the questions have come in, one of the things that you're noticing is that people are having a hard time getting to the major center close to you to get to like a physician's appointment or that kind of thing. Again, just tell us about that. We're having a problem getting people from point A to point B. So we really want to, hear about like exactly where are you going to and from. We want to know about what kinds of services you're going to provide access to. And that's again where those like icons on the screen come in. This is really, really important. And we really want to emphasize that projects don't actually need to provide access to all 3. So you don't have to provide access to medical, social, and basic needs. But we would really like to remind you all, as we've kind of stated a couple times already, that as a social determinant of health, a person's ability to get to the grocery store or to their local senior center or to their friend's house to have tea or do some woodworking is just as impactful, and in some cases actually more impactful on an older adult's overall health and well-being than their ability to seek medical care. And so we like to emphasize that because if we don't want folks to feel like if your project does not include some sort of medical transportation, that it's not thought of as valuable as if you're maybe providing services within your community that are just more related to social and basic needs, because maybe that's what you're seeing. And then the last piece is, I want you to tell us about how your project will lead to positive outcomes for individuals with accessibility issues and older adults in your community. So what are you hoping is going to change in your community as a result of this? What do you hope to see for those older adults in your community? Are they going to be better engaged? Is there going to be a reduced risk of social isolation? Is maybe your community has an age-friendly strategy, and this is really important because you think that this is going to really support that. So just those are the kinds of things that we're sort of considering there. I'm going to pause for a minute again and see if anyone has any questions around this. So one of the questions that has come in is, if the primary client and project is for seniors, but it's also open to other populations in need, is the project still eligible? So my response to this is sort of, we would really need to talk to you specifically about your project proposal. This funding is for supporting older adults, 55 plus, and people with accessibility challenges, mobility challenges. And so if those newcomers and low income folks fall within that bracket, then yes. But if not, then no, those populations are not, like, this funding is not to support those folks. That being said, what some communities have done and what some organizations have done is use this funding opportunity as a chance to be able to develop a broader strategy within their community. So maybe, for example, you have this funding and it allows you to be able to start a program, and that part, the funding from this is really specifically going to serve that 55 plus the people with mobility / accessibility challenges. And then you have other funding that you put alongside that, and you use that funding to be able to support those newcomers or low income folks that are not older adults or folks with accessibility issues. Excuse me, sorry. As a question, can we do a combined EOI for 2 different groups in our community and designate funds to each? Absolutely. In the next slide, I will talk a little bit about how you would work with partners in the community. And so that's absolutely something that we would encourage if that makes sense for your community. Also, I'd just like to share, we are recording this, and so we will send a copy of this to folks afterwards, and they'll also be posting it onto our YouTube. Okay, the next 2 questions in the expression of interest are, will your project include a sliding scale subsidy to support older adults who may not be able to afford the full cost of accessing your transportation program? And if yes, please describe your sliding scale subsidy criteria. So affordability is a very important piece of ensuring that transportation is accessible. And we would like to encourage organizations to consider the inclusion of a sliding scale subsidy to support older adults who may not be able to afford the full cost of your transportation program. Subsidy is defined as the amount that your program would cover for older adults who are not able to afford the full advertised cost or fare of your transportation program. Subsidy does not refer to the operational cost of running a transportation program versus the cost that is charged to individuals accessing the program, the fare. Subsidy refers to the amount that your program would provide to support accessibility to low-income older adults and folks with accessibility issues. Many communities are using the Alberta Seniors Benefit and AISH guidelines to determine whether or not an individual would be eligible for subsidy. And your regional community developer can provide like really fantastic support in terms of working through and thinking about what a sliding scale subsidy might look like in your community. So I'll pause for after this one if there's any questions around like a sliding scale subsidy and what that might kind of like look like within your community. Okay, seeing none, I'll just emphasize again that in the expression of interest, we don't really, you don't need to go into, the most in-depth detail around this part. However, if you are working on an expression of interest and you would like some support in terms of figuring out what a subsidy might look like for your community or how you might administer it or any of those kinds of things, and you want to like bounce off some ideas or get a sense of maybe kind of what some of the projects that have been funded in phase 1 are doing, your community developer is a fantastic person to support with that. So we would like to encourage that. There's a question that has come in around who would administer the subsidy. That totally depends on the project and how the project decides to do that. And so oftentimes what happens for a lot of folks is they ask a question when people are accessing transportation services in terms of whether or not that person is accessing the Alberta Seniors Benefit. And then if they are, then they would provide them with a subsidy. Some communities also kind of what they'll happen is they'll actually get a referral from the FCSS office in the community in some cases, and that person would say to them, hey, like this person could use a subsidy, and then they go about it in that way. There's a question that said, do community operated, even volunteer operations, then need to have application forms for those with mobility health issues, and would they need to apply for subsidy? I'm not 100% operating or understanding the question. So you don't you don't necessarily need to have an application form to access services. But what I would say, and I'm sorry, my lights turned off in my office just by accident by themselves, just what if it looks different now, is that you you have to keep track for this project, if you are successful, unique participants. And so those are the unique individuals that are coming through. And so one of the things that we're working through right now with our evaluation partner policy wise is how do we keep track of that? And we're doing that with our phase 1 folks. So by the time, the phase 2 folks come along, this will all be sort of sorted out. And so you are going to need to have a mechanism to be able to keep track of unique participants or the individuals that are accessing your program. Either way, whether you're a volunteer, completely run program, or you're, have a backbone organization and you have paid drivers, either way, you're going to have to be able to keep track somehow of who's accessing your program and how often they're accessing it and where they're going within those parameters or the buckets that I talked about in the previous slide. Basic needs, social, and medical. So yeah. Oh, okay. So thank you for clarifying your question. Yeah, so some operations require people to fill out like an application with medical history. No, that is definitely not necessary. Totally depends on your individual project and sort of what that looks like. We will have like a base of things that folks need to keep track of for their projects, but if people want to keep track of more information, they are more than welcome to do that. A question has come in around how do we contact a community developer? Our community developers are on here with us as well, so they will let you know how to do that, and we can make a note of your name and we can ensure that somebody there gets in touch with you. All right, and so the last question on the expression of interest is to please describe how you will work with partners in the community. This is important because one of the things, I guess the values or the principles around this project is that the funding is to be able to support your community. And so we really want to be able to have you talk to us about how are you going to work with others in the community? Who might you explore a partnership with, and how might you work together to coordinate transportation services? One thing we've learned so far is that communities with strong partnerships that value accessible and affordable transportation for older adults have models that are sustainable. And so we really encourage organizations to think about how you can work together in the community. And sometimes how I like to refer to this is like inviting people to care. So how are you working with the other folks in your community to invite people to care about accessible transportation for older adults in your community and folks with mobility issues, so that it's something that your community cares about and wants to ensure continues on? And then I'll give you an example of some kinds of partnerships that we've seen to kind of consider. So I talked really briefly earlier about some communities have partnerships with like a taxi company within their town, and they have like a taxi pass program. And so sometimes there's like a flat rate or a flat fare to get around town. And so in most cases, I've seen this with FCSS. So the FCSS office might have a program where you can get like a certain number of taxi passes, and then the cost of, that flat rate getting around town, say it's $10, is only going to cost you $5 now. And they keep track of that. In some of our northern communities, we're seeing some really exciting partnerships with healthcare providers in major centers. And so one of the things that we're seeing is that in some of these northern communities, they're actually able to work very closely with their healthcare partners, and they're able to, for example, have all of their community members have appointments for, say, the ophthalmologist on the same day. And so they're able to work with them. Those healthcare providers know when their transportation is running into that major center, and so they book all the appointments on the same day. And so those are some sort of like exciting things that we're seeing. So that's just another example of the kinds of partnerships that you could consider. And again, your community developer is a great resource and can help you think through. The other thing I would say as well is if, for example, you're thinking to yourself now, cheese and crackers, we don't have, many community partners that we're working with right now, don't worry. I think part of what the expression of interest is also about is to think about who might you want to partner with, like who might you perhaps want to explore something with that maybe you just didn't have an opportunity to think about yet. And so again, and I keep talking about the community developers, but like maybe it's because that's what was my job before this, but they're just such a valuable resource and they can help you think through. And they're also great to help bring the community together and can help facilitate conversations around things like transportation. I can see a few more questions, so I'm just gonna move on to my last slide here with some beautiful pictures of Alberta. So a couple things, and then I'm going to go through and answer the questions that are popping up on the screen. If you have further questions after today, you can reach out to funding@healthyagingalberta.ca, and we will make sure that your community developer is able to connect with you through that. If you really want your community developer to follow up with you post today and you're like, hey, I really want to talk to this person, throw us a message in the Q&A and our community developers will make a note of your name. We can see from the Zoom which community you're tied to. And so we'll make sure that the right community developer for your area is able to get in touch with you. So feel free to do that as well. And I'm just going to go through these questions we have here. So the first one is, folks are curious about what the funding could be used for. Could funding be approved for the purchase of a wheelchair accessible van? And the answer is yes. So it's actually a little bit easier to talk about what the funding could not be used for as opposed to what it could be used for. The funding is very, very broad. So what it can't be used for is to pay off deficits. It can't be used for anything that's not related to older adults, which again is 55 plus, or transportation things for folks with accessibility challenges. And it can't be used for programming that's like not related to transportation. So for example, let's say you have an outreach worker and you want that outreach worker to be a part of your transportation program, that would not be a good fit. That would not be something that the funding could be used for. But in terms of like, can you use it to buy a vehicle? Absolutely. Can you use it for volunteers? Yes, absolutely. You could use it for a transportation coordinator. You could use it for a driver. You could use it for subsidies. We would encourage you to consider that quite deeply, using it for subsidies to promote accessibility for folks. You could use it for honorariums for volunteers. You can use it for fuel, maintenance of your vehicle. So it's pretty broad in terms of what it can be used for. Now, the one thing I will say, just to keep in mind, is that the turnaround time on purchasing an accessible vehicle can be quite lengthy depending on sort of where you're at in the process and where you're purchasing a vehicle from. And one of the things that we're doing right now as a part of the community of practice for the project is compiling a list of accessible vehicle providers because folks are purchasing their vehicles from a bunch of different places. So just something to keep in mind, because right now I think one of the things we're hearing is accessible vehicles take somewhere between like 6 to 18 months to receive. So not to deter people, but just something to keep in mind. Another question that has come in are you looking for applications that consider what happens after March 2026? Yeah, so that's a great question. Thank you for asking. So kind of how the process goes is folks will put in an expression of interest, and then from the expression of interest, folks will have their expression of interest scored based on a rubric, which is based upon the criteria that we spoke about earlier. And then from there, you will be invited to put in a full application. And part of the application asks about sustainability. And sort of to what I had said previously in some of the other, one of the previous slides, is that one of the things that we're really noticing right now about that sustainability piece is that the programs that are the most sustainable, that have been operating for many, many years, are the ones that have a very strong community partnership, and the community really cares about them and is very much like invested in the success of the program. And so if you're a community that, you know, doesn't have anything right now, I think those are really great. I think those are really great things to kind of start to think about in terms of the sustainability, because inviting the community to care is going to really be key to the success. Okay. So another question is, will you accept multiple EOIs and applications from a single organization who serve multiple separate rural communities? So you wouldn't, so no, I guess would be the short answer. You should be putting, you would not, I mean, I guess it would depend. Well, I guess it would depend. So I guess each EOI would be looked at separately. And yeah, each expression of interest would be looked at separately and would be scored individually. So I guess it would be good to get, I think, know a little bit more. For example, if you're putting in multiple expressions of interest from one organization and you're all of the communities are within the same municipal district or county, we might be curious about why you would put in more than one expression of interest when you're all within the same area. So I think that one, I would love to know more. So if you're willing to ask your question, if you're willing to type in the chat again and send us a message, I would love to chat with you more about kind of what you're thinking, if that's helpful. Some folks can't find the EOI application. Yeah, I don't know. Are we able to share a link with everybody to the website and the EOI application? If you're on our website, and our website is if you type Healthy Aging Alberta in Google, our backbone organization is United Way of Calgary, so you would kind of like access it through there. If you go to the Provincial Assisted Transportation page, there's a pop-up. It's right on the top of our main page. It's towards the bottom. So, and it's on there, you click it and it'll download right away. But if you can't seem to find it, what we'll do, our team here will just make a note and we will send you a copy so that you've got a copy of it as well. So we'll make a note of your name here and ensure that we can send that to you. There's a question. If we can't secure an accessible vehicle by the end date of the program, would the funding still be available if said vehicle shows up after the date, such as 6 to 12 months later? So you would need to be providing some kind of transportation program before that. So one of the things I would tell you is that for the folks in phase 1 right now who may be purchasing a vehicle, they already have some other things happening. And in some cases, those would be like volunteer, maybe related programming that's happening. So they have some volunteer drivers. I'm not sure that if your program was looking to purchase a vehicle and you had nothing happening currently, that that we would be able to, I suppose, like look favorably upon that kind of application, because we really do need to see people providing transportation services, uh, you know, within a reasonable timeline. And so if the vehicle didn't show up until after the end date of the grant, then you wouldn't be able to demonstrate that. So that might not be a great fit. I can see some folks that want to connect with their community developer. Awesome. Thank you. Thank you for putting your info in here. We'll make sure we note it down. So this is just a comment. Not sure about, and keep going. Yeah, so there's a question to confirm that the community would be, yeah. So if you are a community that has a local transit system, you would not qualify for this funding. That would be correct. So if you're a community that has a local transit system, you know, applying for this funding to be able to purchase a wheelchair accessible vehicle to get folks to out of town appointments, if I think if it was, yeah, that based on the criteria that we have, that would not be considered to qualify. However, whoever you are, anonymous person, feel free to send me an email at the email address that you see on the screen, and let's talk a bit more about that and about your community, and what that might look like there. Can the EOI be eligible outside of other grant applications for capital purchase, or does it have to be in conjunction with other grant applications? I'm not really sure what that means. Yeah, so one of the things that we'll do after today's session is we will send out to all of you a recording of this session from today. We will also send out a copy of the expression of interest. And then we will also send out to you the list of the community developers if you would like to get in touch with them. There's another question. Hypothetically, we don't have a transit system right now, but what happens if we do get a public transit system within the next year? Are we still eligible? I would say yes. If you don't have a transit system right now, and you happen to get one during the course of the grant, but like you've already been successful in accepting, like receiving the grant, then yes, I would say that you would still be eligible. I think that would, and because if I think about, for example, the other communities that have been funded, you know, maybe they might have like a public transit system that takes place next year, and maybe that transit system is now in place because they started this project. I think that's a positive thing. So yeah, it would be really looking at the current moment. Okay, not seeing any more questions come in. Thank you so much to everyone for taking the time to join us today. We really, really do appreciate it. Again, We've noted everybody who really wants to chat with their community developer, so we will make sure that we connect you all. And if you have any other questions, please feel free to send me an email. I'm happy to chat one-on-one with you or connect you to your community developer, or we can all have a conversation. Any of those things we'd be happy to do. And so yeah, thank you again to everybody for joining us today. And we hope that you have an excellent rest of your week. Thanks so much.